School of Public and International Affairs in Princeton University. May I ask that you mute your microphones, please? Thank you. So she's an author of several books. She published Confronting Zoonoses, Linking Human and Veterinary Medicine at the CDC Journal of Emerging Infectious Diseases. And this publication helped to launch the One Health initiative that seeks to improve the health of all species by increasing communication and collaboration between human, animal, and environmental health specialists. She's also the author of the popular Who's in Charge leadership during epidemics, bioterror attacks, and other public health crises, which was published in 2009. She's also the author of Confronting Emerging Zoonoses, the One Health Paradigm, One Health and the Politics of Antimicrobial Resistance, Who's in Charge leadership during epidemics. That's the updated version of Who is in Charge leadership during epidemics, bioterror attacks, and other public health crises. She also writes online columns for the Bulletin of the Atomic Sciences. So she really has a wide range of experience and information in the area of One Health. And she started her career with a BSc degree in nursing from UCLA. And she further gained an MD from Mount Sinai School of Medicine, and then a master's degree in public health from Columbia University, and then another master's in public policy from Princeton University. She is a fellow of the American College of Physicians and a recipient of the New Jersey Chapter's Laureate Award. And then I think the most interesting for me was that she was awarded with the highest honor of work in One Health by the American Veterinarian Epidemiology Society, which I think is very commendable for me, seeing that she's coming from someone who is in medicine, was actually awarded such an honor in the veterinary medical sector. So we are so pleased to have her, and I would pass over the microphone to her to begin our presentation. Dr. Laura, please.
Thank you so much, Kiki. It's really a pleasure for me to be here and to speak with your group. It's a passion. One Health is a passion of mine, and I'm always happy to talk about it. So you requested that I speak about One Health, food security, and climate change, and that's the title of my talk today. Hold on one second. Yeah. You know, I don't know why my screen has frozen. Hold on one second. My apologies here. Let me try and, okay.
We can see you though.
Yeah, let me.
It's not frozen here.
Oh, really?
Yeah, we can see your movements, yeah.
Yeah, but can you see my screen?
No, not yet. Oh,
okay,
it's gone up already.
Pull that up.
Okay.
Sometimes it freezes when it's not being used for so long. Can you see it now?
We can see it now.
Okay, great. Okay, so this is the One Health umbrella that my colleague, Dr. Bruce Kaplan, created with colleagues from One Health Sweden. And as you can see, One Health encompasses a broad range of areas. And there's an intersection between zoonotic infections, microbial infections, comparative medicine, translational medicine. One Health really touches all of this. But I come to the field from this perspective, the zoonotic infection perspective. And I don't have time to tell you how I got into this, but this is the focus of my talk. I view One Health through a microbial lens. So you are, I'm sure, familiar the One Health concept that human, animal, and environmental and ecosystem health are linked. And this concept provides then a very useful and important framework for examining these complex issues that we're all facing, such as the emerging zoonotic diseases like COVID-19. Food security is one of the most important issues facing us because that's tied in with climate change. And in order to address these challenges, to understand them and to develop effective policies for them, we need to examine the root causes and address them. We need to think strategically and not reactively when we're responding to outbreaks. And I would argue then that people, we interact with our environment multiple times a day by inhaling the air around us and by ingesting food and water. So that is the most profound way that we interact with our environment. And the health of the environment, whether the purity of the air or the quality and purity of the food and the water, is going to directly affect us. In addition to all of this, food animals, particularly ruminants such as cattle, are contributing to climate change through enteric fermentation and their manure production and environmental contamination. And I'll talk a bit more about this later in my talk. And I just want to highlight the One Health Initiative website that my colleagues and I run. It's been serving as a repository for all news and information pertaining to One Health since 2008. It's a labor of love for us. Please visit it. Please tell your friends and colleagues to visit it, and make my colleague Bruce Kaplan happy, because he tracks our visitors every day. And he's retired in Florida and is very happy the more visitors that we get. So again, my perspective is a microbial one, my One Health perspective. And we live in a microbial world, and we must understand it better in order to live in it sustainably. We need more interdisciplinary communication and collaboration in areas of education, research, clinical care, and biosafety and control. So let me first talk about food security. It essentially means no hungry people. And in the 1996 World Food Summit, they defined food security as existing when all people at all times have physical and economic access to sufficient, safe, and nutritious food that meets their dietary needs and food preferences. And it's built on 3 pillars: availability, access or affordability, and food use. It is very important, and the UN recognized its importance in that, making it their #2 goal for their sustainable development goals. #3, of course, is good health and well-being. And I view this as One Health. I mean, all of this is basically a One Health strategic goal that the UN developed without really realizing it, but that is indeed what they did. Now, in 1948, the United Nations declared that food is a human right, but they did not specify what type of food. And the question we must ask is, should a meat-rich diet be a human right? Because that has profound implications for global sustainability. And if we decide that a meat-rich diet is a human right, and I don't mean by eating meat with every single meal, but eating meat several times a week, if we decide that it is indeed a human right, what kind of meat should that be? Should that include only domesticated animals, or should it also include wild animals? Now, countries differ dramatically in terms of their meat consumption per capita. And here in the United States, we are the highest consumers of meat of any other country in the world. So we have absolutely no moral standing to tell anybody else what they can or cannot eat, particularly in regards to meat, since we're eating so much. There are other countries where their meat consumption is really taking off, and that includes Brazil and most notably China. Their meat consumption per capita is really rising. Other countries such as India and Kenya, and in the map that I previously showed you, much of sub-Saharan Africa doesn't eat as much meat as some of these other countries. Now, there are pros and cons to eating meat. It provides important micronutrients such as vitamin B12 and iron. There's evidence that we evolved into modern humans because we hunted, cooked, and ate meat. It's a very nutrient-dense food. And eating meat is an integral part of many cultures and religions, particularly here in the United States, where meat surrounds, we've got the Thanksgiving turkey and the 4th of July hamburgers and barbecues. It's very important here in this country, as it is in many other countries. But there are significant disadvantages to eating meat. Meat's not essential if you have supplements, if you can supplement your diet with the vitamin B12 and other important vitamins and minerals that are commonly given by meat. The most important cons or disadvantages, I would argue, is that raising domesticated animals and or hunting wild animals contaminates the environment and reduces biodiversity, and particularly eating wild animals, it increases your zoonotic disease spillover risks. You also get that in domesticated animals too. So these are really important disadvantages of having a meat-heavy diet, and I'll be talking more about that. So as you're all aware, in terms of zoonotic diseases, they're diseases of animals that spread into people, but these microbes go back and forth. It's not always just in a single direction. And I would argue that most of these zoonotic diseases, whether it's COVID-19, SARS, Ebola, they are emerging either directly or indirectly from society's demand for meat and other proteins, whether through deforestation to make way for agriculture, large-scale animal agriculture, intensive agriculture. It's all tied together because we are altering the ecosystems, the delicate ecosystems and delicate molecular ecosystems of this planet. So for those of you who aren't familiar with the molecular biology of how these zoonotic spillover events actually occur, in the case of SARS or COVID-19, we're dealing with a coronavirus, and it's called a coronavirus because it's got all these little spikes that the scientists thought looked like a crown. And these change, these modify. You can think of these little spikes as keys, and they fit into the cellular lock. So all of our cells have receptors on them. They are basically the locks. And so if this protein key fits well into the lock, then it can enter the cell and infect the cell. So it really all depends on then the configuration of these spikes as to how well they fit into your cellular lock. This one would not fit. And so if you get a mutation where the fit becomes quite good, then you can develop human-to-human propagation and the chain reaction of an epidemic begins. So that's basically how the spillover event occurs. These viruses are constantly evolving. RNA viruses such as influenza or SARS are noted for having sloppy reproduction, and they have frequent mutations, particularly influenza. And so it's these mutations then that allow them to alter their proteins to fit into the cellular locks. So this process, though, isn't anything new. Since the dawn of agriculture, when we domesticated animals, we've had these diseases going from the animals to the humans, or in the case of tuberculosis, actually, we gave tuberculosis to the animals. But it ranges from measles, which came from rinderpest in cattle, brucellosis, Q fever, tularemia came from these animals. And of course, as you're familiar, wild animals come with their own microbes, with the SARS, the civet cats, MERS, you get the spillover from bats to camels, and then COVID-19, there's some speculation that the intermediate host was pangolins, but bats appear to be the reservoir host for these coronaviruses. So these horseshoe bats are widespread. They live in regions of Africa, Asia, Europe, and Oceania. They're called horseshoe bats because they've got these nose leaves that are kind of shaped like a horseshoe and that they use for echolocation. And they're hunted for food in a variety of regions. Their guano is used in traditional Chinese medicines. And they are believed to be the reservoir host for SARS and SARS-CoV-2. So the outbreak of the pandemic began in Wuhan. Again, bats are the reservoir host, and we think pangolins are the intermediate hosts. I don't know if you're familiar with the Johns Hopkins University Coronavirus Resource Center. They have been very good at tracking global cases, deaths around the world. Sadly, the Centers for Disease Control here in the United States has been pretty well sidelined for a variety of reasons. They're just not up to the job during this period, which is quite tragic. There's now about 4 million confirmed cases, almost certainly many, many more, and over 250,000 deaths. Now this was, I posted this, got this data from the 12th, and that's 2 days ago, so you can be sure that the numbers are going to be higher. Looking specifically at Nigeria, the total confirmed cases right now is almost 5,000, and Africa's, at least from the data that we're getting, isn't quite as hard hit as Europe, but you've been, I guess, exposed later, so it's not clear what the trajectory is going to be in the continent of Africa compared to the Americas or Europe or Asia. So the question then we must ask is, well, should the wildlife trade and live animal markets be banned to stop further microbial spillover events? And that's easier said than done, of course, because as long as there's a demand, it's going to be very hard to stop this, because if you ban it, then it becomes a black market and much harder to track. So as long as there's a demand, there's going to be a trade and market for these animals' meats. So then a very interesting comparison between China and India to examine, how exactly does our diet influence these coronavirus spillover events? And these provide an interesting comparison because both countries have live animal markets. Both China and India have over 1 billion people. They both have severe issues with sanitation and hygiene. They are the #1 and #2 total users of antibiotics. They both have severe problems with antimicrobial resistance, but in China, they have a long-standing tradition of eating wild animals and using them in traditional Chinese medicines, where in India, 80% of them are Hindu and 40% are vegetarian. Hinduism promotes vegetarianism. So China's been having these zoonotic spillover events, notably coronaviruses and avian influenza. And while India certainly has its share of infectious disease problems, I mean, they are many, they have not been having the coronavirus spillover events like China. And it's not clear if that's because they have different cultural practices and different diets or what. It's not clear, but I think it's interesting and worthy of further study. So as you all are aware, in access to food insecurity has profound political implications, because when you have very high food prices or when food becomes unavailable, that leads to civil unrest, and people start to riot when food becomes available, and civilization then starts to break down. And you can see a number of cases here when the food prices really peaked. So this is a national security issue. This is a global security issue to make sure that people have food security. And a lot of people in public health don't quite realize the importance of it. So the food security challenges that we face then here in the 21st century is, well, what policies can governments implement to maximize food security? And I would argue, of course, food safety too. Governments have a vested interest to ensure food security because they certainly want to minimize the risk of civil unrest or even possibly revolution if the people are hungry and angry enough. But the key question from a One Health perspective, from my perspective, is how can we feed everyone without destroying the planet's biosphere, the global sum of all the ecosystems, and without unleashing more zoonotic diseases upon ourselves? It's a very tall order and one that requires a One Health approach. So to complicate all of this further, we have to deal with and address climate change. So I'm going to shift gears now and focus more on climate change. And as you will see, that has a